Here is your question.
So many times. The one.
Right, so if you've read and understood, considering it communication skills station, kindly please begin.
Hello.
Yes.
Hello. Hi. So you must be Mrs. X, right?
Yes, doctor.
Okay. I think you are the wife of Mr. X, right? That's
Yes.
have a CT scan, supposed to have a CT scan today.
Yes, doctor.
Okay. So I have some good news and bad news for you. And what do you know so far? What would you like me to tell you and to discuss you about?
Today, my husband is booked for CT scan, and we are waiting for CT scan and then for Mr. Mann.
Okay. So I'm here to talk to you instead of him. I am an associate of Dr. Mann, of Mr. Mann. So I'm sorry that you haven't been contacted before, but unfortunately, I have some bad news for you. And I think it's better to tell you before we discuss about the other possibilities. Do you want me to tell you about that?
Hold on. So you are not Mr. Mann?
No, I am an surgical doctor. I'm an associate of Mr. Mann.
Okay. So what is the
I
bad
am
news?
here to talk to you instead of him.
Yes, doctor. So what is the bad news?
Yeah, so we have the problem with our CT machine. It needs fixation, and it probably needs to be fixed after maybe after a week.
What are you saying, doctor? My husband has a swelling of the tummy since 6 weeks, and now you said the CT is not working. We are waiting since morning.
I'm sorry. I'm really sorry about that. It's an unfortunate and a circumstance, and we're not expecting that. So I'm really sorry about that.
So why do you think he needs CT scan?
Yeah. So he has this tummy swelling, which we investigated, and we think it needs further investigation. And so as to proceed with the treatment and to be specific on which treatment modality to choose, it's really necessary to do the CT scan to check other areas if it's a disease that's spreading or not.
So if CT scan is not there, is there any alternative?
Yes. So we have some alternatives, like an ultrasound scan, which is a jelly scan. You know, they're using it for in pregnant ladies. So, but I'm afraid that I have to discuss that with Mr. Mann to be able to if we can change it to another modality of diagnosis.
Okay.
And we have also MRI. We have MRI, and which is another scan that can be as helpful.
Okay. So if your hospital doesn't have CT scan, why you cannot transfer us to another hospital?
Yes. So transferring needs. I will talk to my senior, to my consultant about that to take his opinion. But I suggest you wait, because transferring to another hospital will also take some time for the processing to take place and for the other place to review your status and your disease, and then they decide to do the CT scan for you. I'm afraid that it will take even longer in that case.
So is it a cancer?
Hopefully it's not, but that's what we want to investigate for, and that's what we are trying to rule out, to know what's going on, and that's why we need to do the CT scan. We did the tapping for, we took some fluids from the tummy, and we are doing some investigations on that. And while we are doing that, we need to do the CT scan to check the other places and other organs to make sure that it's not spreading somewhere else. Then we can
do
decide.
you think he need a surgery?
Probably it's early to decide on that until we make sure that all the investigations are in place, our results are back, and then we will discuss it with an MDT, and then they will decide what's the best plan for your husband.
And he having some breathing difficulty right now.
Yes, yeah, unfortunately, yeah. So I think it's related to the fluid collection that he's having in his tummy, and I will try to get that information to Mr. Mann, and I will try to arrange for that fluid to be aspirated and to be removed, and to help him cope with it and get better.
Okay, doctor. So his brother is traveling now. Should I inform him about the case?
About the test?
About the patient?
I think we better wait until we see all the results, so as to not make him in a situation that he doesn't want to be. I mean, if we tell him something that's probably too early to say, so that's why I think it's better for us to wait until we make sure what the disease is and what status he's in. Then you can discuss with him if he's happy with it.
Okay, doctor, I understand.
Okay.
Okay.
That's
Are
fine.
you okay with that?
Yes.
Right.
Okay.
What
Thank
should
you
be
very
your
much. Thank you for
what should
understanding.
be your closing consultation sentence?
So about the plan that we will contact him, we'll contact the family, and when the CT will be available, and if there's anything we can do for the patient now, like painkillers and relieving symptoms while the CT scan is done,
Okay. With apologies.
the appointment.
Yes, with
And
apologies.
we are really sorry that this happened. It's not what we want, and we hope that we can do the CT scan for him as soon as possible.
Good, thank you.